Good morning, folks. It's Diamond from the Oppenheimer Ranch Project and Magnetic Reversal News, bringing you a COVID-19 coronavirus update on Monday, April 6th, around noontime, Mountain Time. Total confirmed cases 1.3 million, 338,000 in the U.S. The U.S. death toll 9,683, and you can see that curve laying off just a little. In most areas, the curve is, well, we're reaching the plateau on this first outbreak. So if we go to the worldwide graph, let's let that parse up. You can see a small change in the angle there. Reaching the plateau, which will happen in a week or so. We predicted 2 months ago that the peak would be the first week of May, and we're still sticking with that. The worldwide peak will be in the transition from April to May. Now, let's get on with some of the update. The U.S. is nowhere close to reopening the economy, experts say, and this would require the public from realizing that they're safe from catching this virus. Now, with all the fear that has been instilled in the public, this is months away until the public actually thinks that it's safe. Now, there are a portion of the public that, well, Trump again speaks in favor of anti-malaria drug as unproven coronavirus treatment, while the Democrats attack him and thousands of New York City COVID patients are actually being treated with the drug. I don't know why this has become a political debate. The Democrats are going to lose on this because what they're doing is they're preventing drugs from being used that could save lives, period. The dumbest thing I've ever heard. Now let's talk about some of the other dumbest things ever. The World Health Organization, including the director, Dr. Tedros, he's facing calls to resign for deceiving the world by allowing China to cover up the true impact of the coronavirus. Activists are claiming 42,000 or more could have died in Wuhan, and they're still reporting under 4,000. Complete farce over there, so we'll see how that unfolds. Now, the Surgeon General, there he is. He is warning that this week will be our Pearl Harbor moment. Total nonsense, because this is a disease, first of all. No one asked for this. It may be a manufactured war, like all wars, but Jerome Adams also said yesterday, in a stunning reveal, that more people will die from cigarette smoke in the U.S. this year than from COVID-19. Yet, we've shut down the economy, and we've shut down the world. More than 480,000 deaths annually from cigarettes, and COVID-19 will kill less people than smoking, according to the Surgeon General, in a stunning admission yesterday. As lettuce is left to die in California fields, as produce demand withers, and this is because of the closure of all the restaurants in the world. Restaurants were consuming a lot of this produce, and they just don't know where to get it now. They do not know how to get it to market. And many of you have claimed that I'm lying about food shortages. There is plenty of food. There is just no way to get this food to places that people need it. That's how broken our system is. Wisconsin dairy farmer dumped 56,000 pounds of milk yesterday because no one's buying it. In fact, they've restricted the amount of products you can buy in dairy in our supermarket. You can only buy 3 gallons of milk and 3 of this, 3 of that. And I have an excellent video here that may bring us up to speed.
Seems to be some confusion as to why some grocery stores may be limiting the sales of milk during this pandemic, as some dairy farmers are forced to dump milk out. But the Ohio Farm Bureau Federation wants you to know there is not a shortage of milk, and you need to alert them if your store is limiting the amount you can buy.
We want to work with these retailers on an individual basis to make sure they know there's no reason to put a limit on milk. Look here, in this cooler, they have a limit 3 per item. Now, I also want to point out that they already have milk that's, lower in price because it's getting ready to expire. There's not a shortage of milk. And if they want to tell you there's a shortage of milk, well, then we have a problem, because if you can't buy the milk you want, on down the line to the farm, there's going to be more milk than we actually have room for at the farm.
The Bureau posted that clip on its Facebook page. They say dairy farmers are having to dump their milk because the supply is getting too big for the processing plants to handle. Officials say this is partly because the milk that was being made for cheese and yogurt products in schools is now having to be moved elsewhere because of school closures. So that milk is being used to make more milk instead of milk products. If you see a store limiting milk purchases, we have instructions on how to alert the Bureau, as you can see on fox8.com.
Excellent informative video on what's going on with the supply chain and the fact that it's broken, and that there is no alternatives to send your products to market if we don't have one in place. And there's nothing to do with 56,000 pounds of milk. If no one wants it, then to dump it, because it's just going to go bad and become more of a problem. Now, farmers are also destroying crops grown for restaurants and hotels, just like we saw the milk glut is because there's no more cheese being made for schools. And now we have farmers destroying crops grown for restaurants and hotels. Absolutely ridiculous. We could be shipping this to or trading it to other countries for personal protective equipment. At our country, this world is so broken. We need a reset. And if this isn't a wake-up call, it's only going to get worse. Already braced for COVID-19, towns watch the rising Mississippi with fear. There's going to be flooding starting now for the next 8 to 12 weeks. And how are those first responders going to socially distance? And how are the residents if they need to be rescued? This could be a debacle in the making. And according to a government watchdog, hospitals are facing severe shortages of medical gear. Confusing guidance from the government. We reported on this yesterday. Some areas that don't have PPE or not enough are banning doctors from wearing it at all. A travesty to safety, to humanity, and to solving this problem. It's idiocracy. That's what you're living. And here's another example of the idiocracy. Tens of thousands of Chinese tourists flock to a popular mountain range. This is not going to go well there. Not going to go well in China. A revolution is already underway. And what I mean by that, and this is a case example from the French Revolution back in the late 1700s. All the things are in place that were happening back then, which lead to a revolution. The bickering in the government, the supply chain breakdown. We're seeing it happen now. I suggest you read the article. It's very telling. An urgent desire for stability, for a fast resolution to upheaval, is in fact absolutely characteristic of any revolutionary error. The United States may not be having a revolution right now, but we are surely living in revolutionary times. If we do not perceive them as such, it's because of news coverage and everyday conversations alike turn on non-human agents. Instead of visionary leaders or outraged crowds, viruses, markets, and climate change seem to shape events every day. History feels like it's out of our hands, but there will be a point where we will be able to take back control. I hope you got something out of the video. Keep calm. This week is our Pearl Harbor moment, and less people will die than from smoking. Be safe. We love you.